Rocky. I'll be your student nurse practitioner. I'll be doing your assessment today. This video will be uploaded on YouTube for the course. Is that okay?
Yes.
Okay. What brings you into the clinic today?
I'm here for a lung test because I used to be a smoker.
Okay. So I'm gonna be inspecting Thomas's Carson. So I'm gonna be expecting for color for cyanosis. AP ratio is normal. It's 2:1. Inspecting anteriorly and posteriorly. I'm checking rate of breathing, symmetry of chest rise as well, effort of breathing, no use of accessory muscles, no nasal flaring noted, no respiratory distress. I'm also going to be checking for nail clubbing to his fingers as well as his toes, no clubbing noted. So after I do my inspection, I'm going to go ahead and palpate. I'm going to palpate for respiratory excursion, tactile fremitus, as well as coastal chondral tenderness. So I'm going to check your respiratory excursion. You can go ahead and sit at the edge of the bed. So placing my hand on my thumbs on the 10th rib, spanning my hands across. Okay, go ahead and take a deep breath. Check it for chest rise and exhale. Good. Making sure that's symmetrical. You can go ahead and sit back. Now checking for tactile fremitus using the palmar aspect of my hand. I'm going to ask the patient to say, you can go ahead and say 99 for me every time I place my hand.
99.
Okay, placing
99.
it on an intercostal, going on a lateral
99.
fashion. Good.
99.
Good.
99.
Good. And
99.
making sure I do it both anteriorly and posteriorly. Go ahead.
99.
Okay, placing it on the
99.
intercostal spaces.
99. 99.
Okay, good. And I'm making sure I also get the lateral aspects, the right and left lateral aspects. Real briefly, for the respiratory excursion, I just wanted to note that making sure that the chest is symmetrical with no abnormalities during respirations. The respirations are also even and non-labored. So I'm going to go ahead and go back. So after checking for respiratory excursion, tactile fremitus, now I'm going to be checking for coastal chondral tenderness. So I'm going to be with my middle finger and the left hand, placing it on the intercostal space and tapping it with my right middle finger. So go ahead and I'm going to be checking for any dullness and resonance. So majority of the intercostal spaces, or the spaces I'm checking, should be resonant. There might be some dullness to the left area because of the organ, as well as the right lower rib because of the liver. So I'm going to be doing that both anteriorly and posteriorly, checking both sides and comparing both sides. So all areas noted are resonant, making sure I get the lateral aspects as well. After I check for that, I'm going to go ahead, after I do, that was palpation. I'm palpating across the chest. Okay, going on a ladder fashion, checking for any tenderness or pain. Checking for any tenderness or pain, both anteriorly, posteriorly, comparing both sides, and as well as the lateral aspects. I'm also going to be percussing, which is the middle finger, of my left hand. I'm going to place it along the intercostal space and tapping it with my right middle finger across each area, and making sure I note for any dullness and resonance. And like I said before, the dullness may be some on the left side because of the heart organ and right lower because of the liver. I'm going to do that both anteriorly, posteriorly, and lateral aspects, comparing both sides. So that's for percussing. Along with percussion, I'm going to check for diaphragmatic excursion. So you can go ahead and sit back over there. So at the back, I'm going to ask the patient to inhale. As they inhale, I'm going to mark, okay, and hold it. I'm going to mark the area, percuss the area of dullness and resonance. Good. Hold it. So around here is where it changes from resonance to dullness. Go ahead and take a deep breath, exhale and hold. And then I'm going to go back up and check for changes from, okay, you can go ahead and exhale and breathe normally. So I'm checking for diaphragmatic excursion, which maps out the diaphragm movement during full inspiration and expiration. So I was able to note where it changed during inspiration from resonance to dullness and during expirations from dullness to resonance. So it's about 3 centimeters. Okay, you can go ahead and take a seat back. Normal for diaphragmatic excursion is about 3 to 6 centimeters. So after this, I'm gonna be, after I percuss to both sides and check for diaphragmatic excursion, I'm gonna be auscultating. So I'm gonna grab my stethoscope. Okay, so I'm gonna be auscultating both his lung fields, both anteriorly, posteriorly, the right and left lateral aspects, making sure I get the apex of the lung, which is at the external end of the first rib. Okay, take a deep breath. Okay, exhale. Okay, take a deep breath every time I move. Good. Okay, making sure I go on a ladder fashion. Good. And comparing both sides. Good. 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 And left lateral. Good. And right lateral. Okay. And I'm also going to be checking his back to both sides in a ladder fashion. Good. And same thing, making sure that I get comparing both sides and getting the lateral aspects. Okay. After I auscultate for that, I'm also going to be checking for consolidation, which is web. So I can either do a whisper test where the patient says whispers 1, 2, 3, and I shouldn't be hearing anything. There's also egophony where the patient says E, and bronchophony where the patient says 99, 99, and the normal would be muffled tones, and abnormal is you would be able to hear 99. So go ahead and say 99 for me every time I move the
99, 99, 99, 99.
Good.
99.
Good.
99.
Good. And I will do both
99.
front and back. Good.
99.
And so far all the
99. 99.
Good.
99. 99.
And making sure I grab the lateral
99.
aspects as well.
99.
Okay. And all tones are muffled, so that means it was negative for bronchophony, negative for consolidation. Lungs are clear to auscultate bilaterally. No adventitious breath sounds. Breath sounds are present to all areas as well. Resonance noted to all areas. No, so far this exam was normal and healthy. Do you have any questions?
No.
Okay, thank you.